Good morning, everybody. As many of you know, I'm the Fellowship Director for the Integrative Cancer Fellowship, and the purpose of this lecture is to make it clear that oxygen to the tumor is not a bad thing. Certainly, old mythology tells us you don't want to give oxygen to the cancer, to the tumor, because it's going to promote the aggressiveness of it. But that's not what the data shows. So I'm going to summarize right now by saying oxygen is a good thing for cancer. And now we'll get into the data. So hyperbaric oxygen therapy is administration of 100% inhaled oxygen to patients at increased atmospheric pressure. So the question is, does hyperbaric oxygen therapy promote cancer proliferation and metastases? The notion of pro-carcinogenic effect of hyperbaric oxygen stems from the postulated mechanisms such as improved nourishment of tumors due to stimulation of angiogenesis and growth stimulation due to improved oxygenation of tumor mass. The first report suggesting the metastasis-causing effect of HBO was about a group of patients with advanced cervical cancer and bladder cancer. Well, the same author who suggested that it possibly promoted cancer, he actually did a larger study which refuted that. And so this study was published back in 1977. And as you'll see, what I'm going to present now, all this data shows that hyperbaric oxygen does not promote cancer. Actually, the converse. Okay, so almost all other published reports since 1967 have not demonstrated any cancer-causing or promoting effects. Van de Brink et al. Showed significant decrease in metastasis with hyperbaric oxygen. Disease-free survival in 104 patients with head and neck cancer improved with hyperbaric oxygen. No increased metastasis was seen in a controlled trial involving 1,500 patients with head and neck, bladder, bronchus, or cervical cancer. In animal studies, hyperbaric oxygen increased survival time and reduced tumor growth in mice implanted with S180 sarcoma. A recent study found no evidence for persistent changes in tumor microenvironment or tumor growth promotion caused by hyperbaric oxygen exposure in mice. Here's the study published, Hyperbaric Oxygen Therapy Enhances Radiation and Chemotherapy. The authors investigated the efficacy of HBO alone and in combination with carboplatin and as an adjuvant to chemotherapy. In vitro, highly metastatic murine osteosarcoma cell lines were exposed to HBO and cell viability was examined. HBO alone significantly suppressed cell proliferation, and HBO plus carboplatin exhibited significant synergism in suppression of cell proliferation. So what you're going to see here is that if you're going to do damage with radiation therapy or chemotherapy, the cells need to be oxygenated, and we'll talk more about that. In vivo, mice were subcutaneously inoculated with osteosarcoma cells and divided into 4 groups. A control, the HBO group, carboplatin, and then carboplatin in combination with HBO. After 5 weeks, increase in both tumor volume and number of lung metastases was significantly suppressed in the HBO group. Concomitant hyperbaric oxygen clearly enhanced the chemotherapeutic effects of carboplatin on both tumor growth and lung metastasis in osteosarcoma-bearing mice. Mortality in the carboplatin plus hyperbaric oxygen group was significantly lower than in the other 3 groups. These findings suggest that HBO plus carboplatin combination therapy could be an appropriate therapeutic regimen for the treatment of patients with osteosarcoma. And then here's another study, effects of the combination of HBO and 5-FU on proliferation and metastases of human nasopharyngeal carcinoma cells. They investigated the effects of HBO and or 5-FU on the proliferation and metastasis of human nasopharyngeal carcinoma cell line and the underlying mechanisms involved. They divided these into 4 groups. Group A was the control group, Group B was the 5-FU, Group C was the HBO, and then Group D was the combination of 5-FU and HBO. The inhibitory effects on these cancer cells in the 4 different groups were measured after 24, 48, and 72 hours to determine the effects of HBO and or 5-FU on the metastasis. They also measured the expression of matrix metalloproteinase and vascular endothelial growth factor. What you'll see in this study, I'm just going to flip forward. In this study, there was not significant suppression of vascular endothelial growth factor and matrix metalloproteinase. I put this study in there to show you that this study showed that HBO was not significantly effective, but it did no harm.